Good afternoon, everybody. Thanks very much indeed for joining us. My apologies for the late start. Joined this afternoon by Deputy Mayor Sir Richard Lees and also Deputy Mayor for Policing and Crime, Baroness Beverly Hughes. We've had a challenging 24 hours and Greater Manchester leaders have met this morning to discuss events. And what we wanted to do is share with you this afternoon what was discussed and some calls that we would like to make on the government. But if I can, I'll just take you through the base of the statement which should be issued to you as this press conference proceeds. So 4 areas. Let's first start with the evidence base where we agree with the government. You will know that I've been calling throughout this crisis for more data to be provided to local authorities, and in the last few weeks we've begun to see that data arrive and fill in the missing pieces that we had in our jigsaw. So if you look at the slide that should be visible to you on your screens at the moment, this was the picture that Greater Manchester leaders were presented with at our committee meeting earlier this week. It's been updated slightly since then, I should say. And I present this because this is the evidential base for action being taken. As you will see, there has been a significant rise in 9 out of our 10 boroughs over the space of a matter of days, and that prompted a very lengthy discussion amongst leaders on Wednesday, and we had concluded that further action was going to be needed in response to the picture that we could see developing. So yeah, we could see what the government could see, and we'd come to a similar conclusion as to the government. So when the Health Secretary contacted me, it was a conversation where we were starting with the same information, and I was able to agree on the basis of consultation with the leaders that we needed to do something to change what we could see, which was widespread community transmission across our boroughs, and I think the figures provide that very clearly indeed. So as we said to the government last night, we supported the case for intervention. But this morning, the leaders of our 10 councils have raised concerns about the way in which the proposed measures, or the measures that were coming in late last night into the early hours, were communicated to the public. And this is something I share because we only found out about the government's proposals late yesterday afternoon. We understand the government is now in a routine where it considers all local issues on a Thursday afternoon, and this was presented to us late yesterday afternoon without a huge amount of time to influence what was said. But the call that we would like to make on the government is one really for the future. When any similar statements are made, we would strongly recommend to the government that at the time a public or media statement is made affecting any area across the country, it must then follow that detailed information is immediately available at the same time as the making of that statement in a public arena. And we feel that would have led to a much better handling of this situation in this case, and people are able to see the detail and also frequently ask questions, etc. That didn't happen here, and I think that has caused some uncertainty and confusion and distress for some of our residents, and we would ask the government to take that on board when further statements relating to local areas are being made. However, we do recognise that the government needed to act swiftly, and as I've said today, we supported the need for decisive action, but I think there are things that can be done to improve the way these decisions are communicated. So if I may just move on to where we feel there is a need for more clarification. We raised a number of issues this morning on behalf of our residents where there wasn't sufficient clarification. So for instance, could residents of Greater Manchester travel outside of Greater Manchester or likewise could people travel in? And the government has provided some clarity now on that. Likewise on childcare, which has been a big issue for many people. Also people who work from home to home, tradespeople, more clarity has been provided there as well, and we're grateful to the government for that. But we've highlighted two areas where we believe further clarity is still needed, one of which is a concern for Greater Manchester Police, and that is the guidance on gatherings in public places. And we believe we still need to hear from the government how many people are permitted to gather in an outdoor space. And it's unclear whether it's 6 or whether it's a more permissive arrangement that we've had of 30. And we would ask the government to clarify that with urgency ahead of the weekend. The second area concerns hospitality businesses that have outdoor seating areas. We would ask the government to clarify whether they can operate without these new restrictions in those areas, or whether the new restrictions apply, and they need clarity again on that as soon as possible. If I could turn to areas where we believe we need more support from the government, I would say a very significant issue amongst that list is the question of people in the shielded population. Earlier today, the Prime Minister made a speech where he confirmed that the shielding policy will be suspended tomorrow across England, and with that suspension comes the ending of government support for councils to provide the additional help to people who are shielding. We believe the confirmation that the shielding policy is being suspended will cause certainly uncertainty for people in that position, but it also sends mixed messages to people in Greater Manchester. On the one hand, they're hearing that new restrictions are being imposed. On another, they're hearing that some of the support they've been receiving to stay at home and do all the right things is being withdrawn. And we think that's a mixed message. And therefore, we're calling on the government today to extend the shielding arrangements in the areas that are subject to these new restrictions, and perhaps areas where there already are restrictions in place, such as Leicester and Luton. And we believe the extension of the shielding arrangements in these areas should be maintained until the restrictions are lifted. And we further say that our councils should be given additional financial support to provide help for the shielded population in this period. This is a very important request that we make of the government, and we will be grateful for their constructive response. Next, we believe there is a call for help for restaurants in particular, many of which have made major alterations to their premises to be able to operate safely in this time. And the change to say that only households or people within their support bubble can attend in a group and not meet other people, I think will cause another financial hit for our restaurants that are already struggling. And actually they've put in place the social distancing arrangements to obviously to keep people safe. So we would say to the government that if they are not going to allow different households to meet in these socially distanced arrangements that we have in restaurants, which are different from pubs, then further support will need to be provided for hospitality businesses, and particularly restaurants that have recently reopened. We have concerns about the policy with relation to homes and gardens. So we were originally informed that the policy would only apply to homes, but it was then subsequently expanded to cover gardens as well. And there is some concern amongst our leaders that there isn't a clear reason as to why gardens are included and treated separately from other public spaces, and there is a lack of consensus that this is a proportionate measure. So we therefore call on the government to provide further justification on this measure, or if they can't, to amend the regulations, because we are not convinced that it is a proportionate measure. If I could finish then just by making some bigger calls with regard to changes to the test and trace system, which were discussed at our committee meeting on Wednesday. There have been improvements in recent times, and we're very grateful to the Chief Executive of Leeds, Tom Reardon, who did some very good work in listening to local authorities and improving the way the system is working. But it is still not there yet, because we know there is still a low contact rate, relatively low contact rate in some of our more deprived communities, and people are not being successfully traced quickly enough. And in those cases, there is a clear call from our local authorities that if the national test and trace system can't reach somebody who's tested positive within a day or not much more, they then should quickly escalate that to the local authority concerned and pass that case over so that that person can be reached. On our local contact tracing arrangements, we have a much higher success rate of contacting people, and we would therefore ask for a new protocol around escalation to be put in place so that we can quickly contact people who are not being reached by the national system. And again, there will be financial help needed for councils to provide that extra work. Secondly, we are still only receiving very patchy information about workplaces, and this is a major missing piece in the jigsaw, because receiving simply people's home details only often will not immediately identify a workplace where many people may be working that is the actual source of the problem. So we would say to the government there needs to be action taken to include workplace data routinely in the collection of information. And lastly, and actually I would say most importantly, we need to correct a very serious gap in the system before we head any further towards the autumn and then the winter, and that is the lack of financial support for people in lower paid employment to self-isolate. It's the case that there are many people living in the areas that have recently been subject to these new restrictions, Greater Manchester, West Yorkshire, East Lancashire, who are not employed in jobs that support them to self-isolate. They know they may not be paid if they do that, if they're in a 0 hours contract job, or indeed they may fear that they may lose their job if they self-isolate. And even for those who have access to statutory sick pay, it isn't high enough. And we feel this explains one of the reasons for the lower success rate of the national test and trace system in more deprived areas. People know they can't say to the person calling them what they want to hear, or also they are reluctant perhaps to give the names of contacts, knowing that they won't be in a position either to listen to what's being said. So I make this call in all sincerity on the government. You urgently need to address this issue. You need to reach an agreement with employers so that we get to a point where all employees across the country, if they receive a message from the test and trace system asking them to self-isolate, are able and supported to do so immediately. And by that I mean they can do so in the knowledge that they will receive full pay for the 14 days when they self-isolate. If we don't fix that hole in the system, our test and trace arrangements will not be strong enough going into the winter, and they need to be. But I would say to the government, it needs to be fixed sooner rather than later. So that covers the statement that the Greater Manchester leaders and myself have issued this afternoon. Ross, I will hand over to you to take us through any questions. And as I say, we have Baroness Beverly Hughes to address any questions around policing and enforcement, and Sir Richard Lees, who leads on Greater Manchester for Health, who can pick up any questions around the data, the test and trace system, and more broadly, the health system. Ross.
Thanks, Andy. We're going to take straight into questions with Nigel Barlow from about Manchester. Deprivation in urban areas has been cited as one of the reasons why this disease is prevalent and is obviously a factor in the increase across Greater Manchester. But what makes our region suffer more than other areas with similar levels of urban deprivation, such as in the North East, the Midlands and London?
Well, thank you very much, Nigel. Maybe I'll take that question to begin with. I think the link between deprivation and spread of this virus is clear. One of the reasons being the one I just gave, that people are in low paid employment and they're not in a position to protect their health. So even if they become symptomatic, they're not able just to stop work. And then this is compounded by the fact that we have poor, overcrowded housing in many parts of our more deprived communities. And consequently, we know that spread of the virus is greater there. I don't think it is clear that Greater Manchester is suffering more than other parts of the country. It's not at all clear. I think we're seeing a general rise across the country, or beginning to. And as we know, this virus has developed in different ways. It began in London, the southeast, it spread up through the Midlands, it came to the north, but there's no guarantee that this will end in this position. I think all communities where there's a higher level of deprivation are at greater risk from COVID-19, and therefore I think it's incumbent on the government to give more support to those communities and the councils that represent them. So I think this is a growing issue that we need to address. But I think these figures will continue to change. You know, we are not the first to be put under local restrictions. We will not be the last, Nigel. I think this is going to become a fact of life in our country in the months ahead. And I think the figures will change from week to week across the country, and we all need to be extremely vigilant about that.
Thanks, Andy. Richard, did you have anything you wanted to come in on that one?
I think the point is that it isn't just the north. That if you look at the table for concern, if you look over the last couple of weeks, it has fluctuated. The first place to be caught was clearly a place in the East Midlands. There are other places actually fit relatively close to London, places like Luton that are on the area of concern list. But I think what our figures also show is how quickly the situation could change. There's some of our districts that even 2 weeks ago had very low level of incidence of positive tests, and that has changed very, very rapidly. And the likelihood is that unless action is taken, we're going to see similar patterns in other parts of the country as well.
Thanks, Richard. I'm going to go to a question from Richard Marson at the Daily Mail for Andy. It's my understanding that the GM Gold Command was consulted about the government's decision. Please can I ask whether any public health officials were amongst those on the Gold Command? He's also heard there may not have been, and he asks what time was the Gold Command?
I think that may be a question more for Deputy Mayor Ross, who may be in a better position to answer that.
That's fine. Bring in Bev on that.
As we speak, Richard, the Chief Constable, as other Chief Constables around the country, are trying very hard to get clarification from the government as to what the detail of these changes will mean in terms of policing. I'm not sure what you mean by Gold Command. We have a strategic executive group, which is a multi-agency Gold Command, chaired by an Assistant Chief Constable. I don't think they were informed, but there is a public health official on there. In fact, we've got Kate Adhered here with us on this call, and she may be able to answer that. I think this was passed down to the mayor very late in the day without a lot of previous conversation with anybody in Greater Manchester, is my understanding.
Thanks. I think Richard wanted to come in on that one.
Well, it's back on the first question, actually, because as I was speaking, is that today's watch list has just come into my inbox. So this is Public Health England surveillance report, and actually it shows Sandwell in the West Midlands, it shows Northampton in the East Midlands. In 2 days, what I just described might happen in 2 weeks has happened a little bit quicker than that. I think it just demonstrates this is not peculiar to the north of England, this can happen and is happening in other parts of the country.
Thanks very much. Just given the time, we'll move on to a question from Adam Clark at Roch Valley Radio for Andy in the first instance. Rochdale MP Tony Lloyd spoke to Adam earlier and said many people in his constituency don't know where they stand. He gets the sense that the government announcement was rushed. Why do you think the government announced the measures so late at night rather than waiting for a press conference that could have been organised today?
Thanks, Adam. I think that is a question for the government, to be honest. But I noticed last weekend when they had the data about Spain, obviously a very quick decision was made then. And I guess this falls into the same category. You can see the figures that we put up in front of you before. The figures are clear. And I think ahead of the weekend, a clear message was needed to be sent, and that's why the government didn't waste any time. I should say I didn't necessarily say that it shouldn't happen last night. I think our feeling was if it could be made last night, it should be. But I think the bit that took us by surprise, which is what I said at the beginning, is the lack of detail underpinning what they were saying. And that, I'm afraid, did take us a little bit by surprise and left us in a position last night where we didn't have that. We'd had the headlines. We'd assumed there would be a kind of more detailed communication to support any ministerial announcement, and it was the lack of that that caused the concern. But I think we're in a situation here, though, Adam, where it's fast moving. The figures can change from day to day. I think, as Sir Richard was saying a moment ago. And once you're in possession of figures, you don't want to sit on them. If you think action is needed, as we judged it was needed earlier this week, then I think you have to act. So, I don't want to sort of give the impression here that we're now, saying the government got it completely wrong. I'm not saying that. I think they were right to act. I think they were right to act quickly. I think the measures are proportionate and are as modest possibly as they can be, taking aside a few of those points we made around gardens. What I'm saying is just make sure we've got everything lined up in future so that the public's questions can be fully answered. These are announcements that the government makes. They're not made by local authorities, and therefore we have to deal with the consequences of those announcements. And I would just say to the government going forward, on a Thursday, if you are making changes to local arrangements, please have all supporting information ready to go before any public statement is made.
Thanks, Andy. Going to go to a question from Joshi Herman at the Mill. One for Richard, I think, in the first instance, then possibly one for Kate. The question is, how big a part did house parties hosted and attended by young people play in the large increases in cases in Oldham and Trafford? And if these weren't the main spreading events, what were?
We've certainly seen a significant increase in the number of younger people who have been testing positive for COVID-19. And we believe that is because young people have increasingly been acting, well, I think, first of all, as if COVID-19 was over, but to a certain extent, as if they're almost immune to it. I think house parties, illegal raves, all of those things will undoubtedly have played a part in that, but we've also seen young people mixing in a whole range of different settings in what would have been seen a relatively normal way 6 months ago isn't anymore. And indeed, it's one of the main themes that we do want to convey from Greater Manchester to young people in particular, is that they are not immune. They might suffer a lower level of symptoms than perhaps a lot of older people have been doing, but we still have had deaths amongst younger people. We know that younger people who contract coronavirus, even if they have mild symptoms now, can do themselves long-term lung and heart damage. And of course, the big risk is that they might not be especially vulnerable, but they are capable of transmitting the virus to people, including friends, family, who are a lot more vulnerable. So, yeah, we can't prove a direct connection between those events, but we can be fairly certain that young people have been increasingly socialising in those sorts of ways will be a major reasons why a far larger number of young people are now testing positive.
Thanks, Richard. I'll bring in Kate on that point as well.
Yes, and just to absolutely agree with everything Sir Richard said about the degree of socialisation that young people have been participating in. And I think it is important to remember that physical distancing, hand hygiene, all of that, those measures are incredibly important right across all ages. So the majority of infections we are seeing are in that sort of younger age group as opposed to the older age group that were previously affected. I think this is a very similar pattern to what's been taking place in Europe as well. So it's very much driven by that younger generation socialising. I think it's also important for to remember that there is perhaps a sense about the use of testing as well, in terms of I think people sometimes think if they have a negative test after they've been socialising that they're okay, and I think it's important to remember that this virus has a 14-day incubation period. So you know you're only negative on the day that you have the test. You are not necessarily clear until you are clear through the incubation period. So it's very, very important that we adhere to the measures about socialising and hand hygiene. So really important to do that. And for young people to remember that, yes, they are not immune. This is a virus to which we have no vaccine and no drug intervention presently. So to comply with public health measures, you're not only protecting yourself, you're actually protecting those you love. And it's really important for all of us to remember that.
Sorry, the next question is from Josh Halliday at The Guardian. One for Andy in the first instance. Firstly, how will the new rules be policed, and how does the already stretched GMP feel about having to stop people visiting each other's homes? We'll bring in Baroness Hughes on that. And secondly, an MP in West Yorkshire has claimed that Muslims in his constituency are, and he quotes, just not taking the pandemic seriously. He's asking, is there any evidence of this in Greater Manchester?
Ross, shall I let Bev take the GMP question first, and then I'll take the MP's comment second?
Thank you. Thank you, Josh. Well, as you rightly say, the police here, as in lots of other places, are very, very overstretched. Crime levels are rising to normal. I have some very serious cases recently, including another stabbing murder of a young man. And the range of COVID compliance activity, particularly focused in recent weeks on illegal raves, on illegal car rallies and on large house parties and so on, continues. So the operations that we've mounted over the last few weeks will continue through August in relation to those kinds of activities. And there will be a very significantly increased presence of the police over this coming weekend because of intelligence and what we expect. But on the changes to these new rules, as you say, it really takes us back, doesn't it, to the situation that pertained several weeks ago now, when the same restrictions on people visiting others in their homes and having people from other households, and we did get then in the police barrages of calls from the public, well-meaning members of the public, but nonetheless it creates another very, very significant demand. I think I need to make clear that the police have no powers to enter people's homes without those people's consent. The focus that we'll adopt will continue to be what we did at that time, which is to engage people, to encourage them, calling on the public to consent and to voluntarily abide by these regulations, to explain why they're necessary, and only if absolutely necessary, enforce them. But the enforcement powers the police have are restricted really to instances where there are concerns about public order. And in that case, there are powers we can use, and also there's the fixed penalty notices, and that would really be in the case of very large house parties or situations where there is disorder in and around a property. So, you know, the police are ready for that. Their resources are finite, but as ever, they will do the very best they can to make sure that people are protected and that they can encourage people to comply with these new regulations.
Thanks, Bev. I'm going to go back to Andy and then we'll bring in Richard.
Thanks, Josh. So as a former MP, I can kind of say that I just don't think it's a good idea ever to make sweeping generalisations about your constituents, and particularly poor idea to single out one group within your community for such comments. As the figures we presented today show, there is a minority of people in all communities who perhaps aren't following and haven't followed the guidance as closely as they should have done. But there are particular reasons why the poorest communities are finding it harder to follow the guidance, and I've given some of those today. So I really don't think those comments are helpful at all. And I think it's a question of supporting all communities, giving messages, clear messages to them, so that, and then the help they need to follow the guidance. And I would say, as a member of Parliament, he should be challenging the government to ensure that that support is being provided and that his council has the resources on the ground to do the contact tracing that the national system is missing.
Thanks, Andy. Going to bring in Richard.
It's on that MP's comment. I just want to be a little bit more specific and to say that within the City of Manchester that we've had phenomenal cooperation from our Muslim communities in general, but from mosques in particular, who've really worked with the council, with the GMP, to make sure that we do operate in a way that keeps all people safe, including, of course, their own Muslim communities.
Ross, can I, sorry, to come back with a further point as well? I apologise for playing tennis there, but I just want to say something else on the back of what Richard's just said. You know, the community that's facing most disruption today is the Muslim community, and you know, I think, you know, it's, if we put ourselves in the same position of changes being announced late on Christmas Eve, you know, how frustrating would that be? So I think we've got to. I want to send a message, an Eid Mubarak message, to all members of the Muslim community in Greater Manchester and beyond, actually, and say we know that this must be really hard right now with these changes being announced in the way that they have. But to say as well, as Sir Richard, thank you for the cooperation that we've had from mosques across Greater Manchester to ensure that there are safe arrangements in places of worship. And while people may not be able to meet together this year in their homes, let's hope that we're in a position where that can happen next.
Thanks, Andy. I'm going to go to Grace Marner from the Oldham Chronicle. It's a question for you. When were you told about the decision for a local lockdown, and why wasn't it announced earlier?
Thanks, Grace. So I was told late yesterday afternoon. It was around 4 o'clock, so not a great deal of time. And obviously it wasn't a sort of long consultation, but we were consulted, to be fair. And what I said to the Health Secretary was I wanted to take what he was saying to me back to the leaders. The government were talking about making an announcement in the evening. I said, well, could I have a chance to discuss this with people? We recognise the need for action, as I've said at the beginning, but we also just want to kind of consider what this will mean. So it was late in the day, but to be fair, the government did put things on hold to take our feedback on board. So we appreciate that, but as I say, yeah, we would have even more appreciated more clarity and coordination in the announcement. So it's a case of we are where we are, and these points are being made not to pick holes or to pick a fight or anything like that. All the way through this, we've tried to say, look, we'll help where we can, but if something isn't quite right, we're going to speak out directly on that as well. That has been the Greater Manchester approach. That will continue to be the Greater Manchester approach. We will work together with the government in the interests of national unity, but we will also very directly say to them what we think needs to be done that isn't being done. And we're continuing in that spirit today.
Thanks, Andy. Carol Lowe from BBC Northwest Tonight asks, we've heard a lot about deprivation driving rates of infection. Does this mean people living in wealthier areas like Altrincham and Hale have become complacent and that younger asymptomatic people are unwittingly spreading COVID? Give that to Richard in the first instance.
Well, to a certain extent, I think we've touched on that in an earlier question, and I think the short answer is yes. Not just in wealthier areas as well. Is that I think younger people have become. I'm not necessarily complacent, but they're certainly not complying with the guidance that has been given, and that is having the impact, first of all, of an increased number of positive tests amongst younger people, and quite likely a significant number of younger people will be asymptomatic, and yes, they almost certainly are spreading the virus, and that's a reason why, particularly in some parts of the conurbation, we are seeing that rapid increase in numbers, and it's certainly the case for Trafford, but we've also seen very recently a significant increase in Stockport as well.
Ross, if I may, just to say, I agree with what Richard said, but I think it's also important to recognise that it isn't just young people socialising that might be causing spread. There are many people who work in hospitality settings, young people, and we have had some reports that there is variable implementation of the requirements on licensed premises to take names and manage the environment properly. So I think there needs to be a new focus to ensure that the people who are working in those environments, often younger people, are properly protected, and that's an area of concern for us too.
Thanks very much. I'm going to take a question from That's TV. Maybe want to bring Bev in, but go to you first, Andy. How do you plan on making sure these new measures are adhered to? Andy, we'll go to you first on that. I'll go to Bev after you.
It's a good question from That's TV, because it's going to be challenging, of course, but I think maybe people are waking up to a different reality here, that we are living with this virus amongst us now, and it is, as you can see, on the rise again. So I think people will be making their own judgments about their own safety, their families' safety, and how they need to go about things. And if you could see these figures for Greater Manchester today, as we've put them, and hopefully through you they'll be communicated to the people of Greater Manchester, it just doesn't make sense, does it, to invite people into your own home and put your family at risk of infection. It doesn't make sense. So we are kind of urging everybody to take on board what is happening here. There is evidence of a change on the ground, and consequently, when the facts change on the ground, we all need to consider our actions. Of course, there will be the potential for some enforcement. Greater Manchester Police did act earlier in lockdown to break up situations where there were persistent gatherings, so we will be working with them again to do that, but we are doing it mainly through an encouragement approach, an educational approach, and we are asking for the support of the Greater Manchester public. We would not have agreed to these measures if we did not think they were necessary. We do think they are necessary, and it's about everyone's health, not just your own health, your mum's health, your dad's health, your grand's health, your granddad. Think about that as we go about our business this weekend.
Thanks, Andy. Bev, going to bring you in on that point as well.
Thank you. Thanks, TD. I think it is a key question, isn't it, really? Because if everybody took on board both the new measures and the long-standing existing measures, particularly that about keeping 2 meters apart from others, then actually, we could curtail the spread of the virus much more effectively. I think the regulations that are coming in, and I gather it'll take about a week for these regulations to come into force, but those regulations about people going into other people's homes and the numbers of people that can mix together inside a house, I think we depend largely, on the public to consent to those and to, enact those regulations voluntarily, because there isn't a great deal of enforcement in terms of small groups of people in their own homes that we can actually apply. If it's a very large gathering, we can intervene and the police will do so. But as Andy said, there's other measures as well that the police have already used, not just the police actually, but with the licensing officials from local authorities and other agencies working together to make sure that the bars and the pubs are complying with protective measures. And a couple of places, as Andy said, were closed down recently. We'll continue to do that and to use whatever measures we've got in terms of those gatherings outside. You know, there seems to be a view almost that if it's outside now, it's okay. It isn't okay. And if you get too close to people, even in a large gathering outside, you can be spreading this infection. So the activity around those large gatherings outside will also continue.
Thanks, Bev. Just conscious of time, so I think we started a bit later, so we'll run over a bit. So quite a few questions to get through. Those colleagues who've submitted more than one question, I might not be able to ask more than one. Next question is for Richard in the first instance. It's Stephen Kingston from the Salford Star. He says he's just got the latest local authority watch list through from PHE, and every borough of Greater Manchester is on the watch list, but Salford. Is this a mistake or is something else going on? The list states that all these boroughs are the target of interventions, which I assume is the clampdown announced last night, but Salford is not on there. Richard, a question for you, because I think you mentioned that you'd seen this list very recently.
Yeah, I think there are a few anomalies in the list. I mentioned Stanwell earlier, and Stanwell has a significantly higher rate than many of Greater Manchester boroughs, but it's listed as concern rather than intervention. Certainly, Salford is in the middle of the pack, if you like, from a Greater Manchester point of view. I don't know if Kate can give any enlightenment, but I can't see any rational reason why it's being treated differently to other Greater Manchester districts at the moment.
No, it isn't, Sir Richard. Salford is definitely on the list and is part of the. So unfortunately, that it's a mistake in the list rather than that Salford is not included. So Salford is under the same measures as the rest of Greater Manchester.
Thank you. Sir Richard, a question for you in the first instance as well. We might take it to Andy from James Much at the Bolton News. What would you say to people in some towns with lower infection rates, such as Bolton, who may feel aggrieved by having to follow the new restrictions?
Well, I think it's something we've said earlier, is that what we want to do is to take preventative action before we get into a situation where we have to take far more severe action. And something Andy's talked about earlier is that in Greater Manchester, people have families that are spread from one district to another. People travel to work from one place to another. And actually, yes, people will travel outside Greater Manchester, but if you look at travel to work patterns, they are largely within Greater Manchester. So the level of risk is greater from that point of view. So, and Bolton actually has a relatively high rate. So I'm not sure why they would be feeling that aggrieved. I see Kate Ardens mentioning Wigan. Actually, if anywhere would be aggrieved, it would be Wigan, which has by far the lowest rate. But it really is. So because of the way people move around, let's take action now. Hopefully in 2 to 3 weeks, we'll be able to move back to a relaxation regime again. But the way things were going, if we didn't do something, the risk was of a far more severe lockdown.
Thanks very much.
Briefly, Ross, if I could, just very quickly, just to say to James, you know, I think it's the wrong way to look at it, James, if we just break down each community one by one, because Bolton was higher in weeks gone by. Wigan has been high at some point. And as Sir Richard was saying, you know, there are residents of Bolton and Wigan that are working in other boroughs of Greater Manchester where the rates are high and they may be bringing the virus back. So we're all interconnected, and I just don't think it's helpful to sort of do it on a piece by piece basis, a borough by borough basis. I think you've got to look at the overall picture. The overall picture is that cases are growing all over the city region, and if we took Bolton out, Bolton would have a much bigger problem within a week or two's time, and I don't think anybody in Bolton would thank us for doing that.
Thank you very much. Just to say, there's been a couple of cameras flashing to different people. It was just a couple of wee technical hiccups, but I think they've all been sorted now. Kevin Fitzpatrick from Radio Manchester asks, what do you understand to be the criteria for lifting these restrictions, i.e. how many cases per 100,000 would restrictions ease? Also, Hazel Grove MP Will Ragg has said the Health Secretary has assured him that the measures will be reviewed weekly on a borough-by-borough basis and even more local than that. How will that work practically from your point of view, Andy, in the first instance?
Well, I don't have those criteria, Kevin, because the government have never set them out. We've asked them to, but we don't have those thresholds either for intervention or for then de-escalation. We continue to believe it would be helpful if the government clearly set them out so everyone knows where they stand. On the second part of your question, I had an assurance from the Secretary of State that the measures will be reviewed on a weekly basis. I'm hopeful, if people follow the advice, that they can quickly be lifted. And I would say to everybody, that's what we've got to aim for here, and that's why people should follow the guidance. But I don't believe that the Secretary of State is proposing that we look at this piecemeal, because it's not possible to look at it borough by borough, because obviously, as you can see, there is sustained transmission across all boroughs, and I don't think you can look at the picture of one borough in isolation from another, given the way Greater Manchester functions. So, I would say this has to be a GM consideration, and that's the view of all of our leaders, and we will continue to suggest that the government works on that basis.
Thank you. Richard, did you want to come in on this one?
There are of the various measures that we've got. So positive cases per 100,000. In terms of the number of tests, the proportion that are testing positive, and so on. There are ratings that are green, amber, and red. In terms of those ratings, the reality is that most of Greater Manchester, in most of those categories, is still in green or amber sections rather than red sections. I think the issue here is not what those thresholds, it is really the direction of travel, the way we appear to be going, and the speed at which we appear to be moving in that direction as well. So I think it's a reason locally we've seen the need for justification to be justified. Sorry, the need for intervention to be justified is simply because when we looked at the figures and at the rate they were moving in the wrong direction, we wanted to. I think it's a phrase I've heard Andy use, is nip it on the bud before it got any worse. But there are say green, amber, red thresholds. We want to try and make sure we don't reach red in reality.
Thanks, Richard. A question from Rowan Bridge for you, which goes back to a previous question you'd answered, but I want to see if you wanted to add anything more. Several MPs have been tweeting complaining of a blanket approach. Tameside has 15.54 cases per 100,000 and Oldham 54.33, yet both are treated the same. If this is about geography and people travelling between locations, then why not include parts of Cheshire too? I appreciate these are not our decisions, but you've been supportive of the move.
Well, again, since the question was written, I think Tameside's moved to 16.3. It's, I've said, this is a dynamic position. We are interconnected. Tameside has clearly very significant overlap with Oldham across its border. The intention is to make sure that that Oldham moves towards Tameside, not Tameside moving towards Oldham going forward. I think we've covered that, but I think that's relatively simple and straightforward. And I think it's what Andy's just said. Each individual part of Greater Manchester is not an island.
Thanks. Unless anybody wants to come in on this one, we'll move on.
Just to very briefly, Ross, say that I will be meeting all Greater Manchester MPs later this afternoon to obviously hear their concerns. I think that the point is the one Richard made about growth. That's the issue when you look at the figures that we presented today. It's the increase. So all boroughs. Tameside was 4.9 last week on the latest figures. It's 16.3 today. I don't think people could be relaxed about that change over a week. So all of this is about stopping us getting to the position of something much worse, and that's why we've agreed on this decisive action now to prevent something worse later down the line.
Thanks, Andy. A question for Elizabeth Rushton at the Rochdale Observer. Andy, you said on a previous briefing that you thought a local lockdown would represent a failure and you considered it a last resort option. What has gone wrong in Greater Manchester to bring things to this point? Rochdale has just been through 2 weeks of extra lockdown measures which appear to be working, with its infection rate being the only one to fall in GM this week. What do you say to people who have stuck to these rules but are still going to face tougher restrictions?
Thanks, Elizabeth. So on the first part of your question, I don't consider this a local lockdown. I think what happened in Leicester was a local lockdown where businesses were told to cease trading. That was a return to where we were in March. This isn't a lockdown because people are free to leave their home and go to work. It's a restriction is what it is on what they can do at home in terms of having people come to visit them, but I don't think you could describe it as a lockdown. So we are taking these measures actually to avoid a lockdown. I mean, that is the entire point. You know, you've got to do everything you possibly can to prevent us getting to the position where businesses are asked to cease trading, people are not able to go to work, and that is what this is about. So I'm not sure it's a case of what's gone wrong in Greater Manchester. There is rising case numbers across the country. We would feel very sorry for the people in Rochdale who clearly are beginning to do who have done the right thing, and the figures are beginning to show the effects of them doing the right thing. What I would just say to them, though, is they're clearly not fully in a position yet to relax, because with 31 cases per 100,000, that is still a high number of infections. So, you know, that is the way I would, would answer this, your question. And I do say, rather than getting to a position where we're blaming individual communities or blaming whole boroughs or whole areas, there are holes in the national test and trace system that need to be fixed, both in terms of the supply of data and the financial support for people to self-isolate. Can't hear you, Ross.
Sorry, it was going to happen once. Apologies to those colleagues who have asked second questions. Given the time, I'm going to just try and make sure that everybody gets one in. So to that end, Hannah Miller asks, when the proposal were first presented to you by government, was the government insisting they would apply across the whole of Greater Manchester, or were they looking to target specific areas?
Thanks, Hannah. No, it was always a Greater Manchester proposal. So I can give you a very short answer on that. There was never a suggestion that it would include some boroughs but not others. What was suggested was it might cover a much wider area across the north, and I do believe that was considered by the government, but they decided upon the area that they announced last night.
Sarah Tunridge at HuffPost asks, I understand that test and trace data was used to identify the increase in infections in parts of the northwest. But in his tweet, Hancock said, the spread is largely due to households meeting and not abiding to social distancing. Could you please explain what evidence was used to determine the fact that people were not socially distancing? What data was used to prove this? I can put that to Richard and then Kate. Like me, Richard, I think you're on mute.
Sorry. One of the bits of data we're now starting to get is patients' individual identification data. So when people are being tested, we now know basically where they live. We're able to start being able to trace where the likely transmission place was. And I think now, as we start to get more complete data, I think Kate's the expert on this and might want to say a little bit more, but because we are now beginning to get that data, we are more able to identify where the likely source of transmission was, and that also means we can tell when it is one member of a family who tests positive, and then a few days later other members of the same family test positive. So we now have that data. We didn't used to have the data. I'd say it's worth repeating. that in terms of incidence of positive tests, they are now nearly all in community settings rather than in health or care settings. And the other area of concern, as well as in-home, in-family transmission, is that of young people socialising, something we've touched on earlier.
Thanks. I'll bring Kate in on that.
Thank you. And yes, absolutely. The patient identifiable data that we've now got in contact tracing, and indeed our own local contact tracing system, certainly has identified household transmission and the fact that you've got social groups transmitting, so that it was absolutely imperative for us to get that patient identifiable data so that we could actually investigate that local community transmission that was going on. And I think, just to reiterate, in terms of the success of our own tier 1 system, that's in Greater Manchester and across the 10 boroughs, we are now at 98 to 100% in terms of tracing contacts of confirmed cases and managing the consequences. And within that, we are seeing household transmission.
Thanks. Kate Proctor at The Guardian asks, she joined late. So Andy, we'll take this to you first. You've addressed some of this, but not quite all of it, I don't think. Exactly what time and who from government got in touch with you to explain that a lockdown was going to happen in the next few hours? Did anyone call you direct from Westminster? How much time did you personally have to prepare? But I think the final question is probably the one you've not touched on before, which is, what was your immediate reaction?
So it was the health secretary who called me, and he said he was about to go into a meeting with the chief medical officer. I think this is now an established meeting on a Thursday afternoon where the health secretary and the chief medical officer review all the data across the country and consider proposals for local restrictions. He said that they were going into the meeting. I think it was due to start at sort of 5 o'clock, and I think they delayed it slightly because I asked for more time to consider what they were saying. My reaction was, well, it wasn't one of surprise, because obviously we were looking at the same data that they were looking at, so I could see the case for action. So it's why, I said straight away, well, I can see why you're saying what you're saying, but the question will be, what does it mean for me? How is it going to be implemented? Why not this area, but this? So that was my reaction. It was a constructive reaction. I was grateful to him for calling, and we dealt with it as directly and as straightforwardly as we could. I think our frustrations came in later on in the evening, if I'm honest, Kate. Where having kind of communicated what we felt and put forward some of the kind of concerns that that leaders had, the way the announcement happened later on in the evening, I think, kind of lost some of the handling, if you like, and I think with hindsight, there is much more that should have been done to inform the public properly at the point of the statement.
Thanks. Andy, given that we're almost out of time, we're going to take this as the last question, so apologies to those who have submitted second questions that we've not got to today, but the final question is from Jen Williams at the MEN for both Andy and Richard. Jen says she thinks she's right in saying that the exact measures that have been announced by the Health Secretary were not as discussed with leaders here beforehand. Do they think that the Health Secretary has acted in good faith? And secondly, how much of an issue is the difference between the published guidelines and some of the comments made by Mr. Hancock today on things like beer gardens, which seem to be contradictory? So Andy.
So thanks, Jen. This in some ways goes back to Kate's question before, in that obviously it was a phone call. We weren't given a document late yesterday afternoon. And the Health Secretary took me through the proposals that he was about to discuss with the Chief Medical Officer. And as I understood it first, it was to deal with homes and not necessarily people's gardens. So that wasn't clear, and we didn't have all of the detail. And it would appear that it was changing even within government as to what exactly was being proposed. So this is the frustration at times, of course, isn't it? The conversations raging down in Whitehall, we get a bit of it and then having to react to that. But I don't think the Health Secretary acted in bad faith at all to address your question. In fact, he did act in good faith. I would certainly say that. I appreciated his call. I appreciated the opportunity to feed in. We kept in touch later on in the evening. I relayed my concern about the communication later on to him. But no, I've been in his job in a pandemic. I know what it's like. It's not easy. Quick decisions are needed. I would rather the government make quick decisions than prevaricate, but it's just making those decisions with all of the supporting information. And you know, I think the picture did change, and it did cause us some surprise. But obviously, it's for the government to make those decisions. We're only feeding in. We are not able to dictate what the final decision is. On the second point about you know, the potential contradictory statements made today, it's why we began by asking for clarification on outdoor areas operated by hospitality businesses, i.e. beer gardens and other such places, because it isn't clear yet, and I think it does need to be cleared up completely, as do any other outstanding concerns that the public have. I think, just to finish, Ross, if I may, the shielding point, I think, is tremendously important. You know, it cannot feel right, can it, for somebody being at home today who's been shielding for months to hear that new restrictions are coming in Greater Manchester and to fear what that might mean, and then at the same time to hear, oh, and your support is about to be withdrawn and you might need to go out to the shops to get your own. I mean, clearly, the government must be able to see that there is a mismatch in that messaging that will cause real anxiety in people's minds. And I say this to them directly. You know, I'm doing my best to work in partnership with you, but you need to listen as well when we say things that we think we need. And we think we need more support for people in this position, and that the arrangements should be extended for the duration of these restrictions. And I say that in a spirit of wanting to kind of work together, carry everybody through this difficult moment, because it is a difficult moment. But statements like that, I don't think, help us. And I think the government needs to follow through the logic of what it's done. It's put in place extra restrictions on a certain area. Therefore, I think it should make amendments to its shielding policy to reflect that decision. So I say that to the government. I ask them to take that on board, as well as these concerns I've repeatedly raised about the test and trace system. It has got gaping holes in it, particularly this question of financial support. The later we go into this year, into the autumn, into the winter, we will be exposing ourselves, and particularly some of our poorest communities, to unacceptable levels of risk. It isn't right. It needs to be fixed. I call on the government to do it. Thanks, Ross.
Thanks, Andy. If we've got nothing further from anybody else, or if anybody has any final comments,
I think wasn't Jen asking me as well? Sorry.
Yes, it's been a long day, Richard. I apologise.
I'll be very brief. I think it's fairly clear that what was announced in guidance was not what we were expecting on the basis of conversations last night, and it's also equally clear that we're not clear about what the guidance means precisely. I think what Andrew said about the need to act quickly, I agree with entirely. We really want to be on exactly the same page with the Secretary of State, because this will work best if we are working together. And so what we're hoping to do is to have a real engagement with Secretary of State and officials now about refining the guidance so that we do have something that works properly for Greater Manchester.
Awesome.
That's great.
Leave you.
Yeah. Thank you, Richard. Yeah, if nobody else,
thanks everybody.
Thank you.